OCD treatment, therapy, and medication plans. Hi, I'm Michelle Risser. I'm a licensed therapist, and let's go over OCD treatment, including therapy and medication. In this video, we'll go over the most effective treatment options for OCD, therapy and medication options, and additional treatments for OCD for people that don't respond to the standard treatment. If you'd like to learn more about OCD, go ahead and watch our full OCD overview that we've linked in the description. So what is the most effective treatment for OCD? Generally, exposure and response prevention, or ERP, is considered to be the most effective type of treatment used to address OCD. However, some factors like the length of the illness, the severity of symptoms, and treatment history will all play a role in determining the best option. Some patients may choose to add medication management to their treatment plan. Let's go over therapy for OCD. OCD is most often treated with outpatient therapy. Positive results can be seen as soon as 4 to 6 months. In some instances, clients will require longer outpatient treatment or even a more intensive inpatient treatment. Therapy techniques to manage OCD are exposure and response prevention, or ERP. ERP is the gold standard for OCD. In ERP therapy, the client and the therapist formulate a list of the feared items and gradually expose the individual while avoiding the usual compulsive responses. Mindfulness-Based CBT. This trains people to have an observational stance versus a judgmental stance regarding their thought, feelings, urges, and physical sensations. Habit reversal training, or HRT. This works to have the person challenge and end the compulsive behaviors through recording, awareness training, competing response training, and habit control motivation. Psychodynamic therapy. Psychodynamic therapy with OCD is a controversial subject. There's some limited evidence. More recently, experts have pointed to a specific type of psychodynamic therapy called short-term psychodynamic therapy, or STPP, as a helpful option. This form of therapy uses 12 modules of treatment to effectively address OCD. Medications that can be used to treat OCD include fluoxetine or Prozac, fluvoxamine or Luvox, sertraline or Zoloft, and citalopram or Celexa. This is not a complete list. You should talk to your doctor or your psychiatrist about any medications you are taking or are interested in taking. What are some additional treatments for OCD? For patients who don't respond to the traditional therapeutic approaches, there are several less common methods, including TMS, or transcranial magnetic stimulation. Some of these approaches do not have as much evidence to support their success, but many people and their teams find them helpful. Other types of treatment plans for OCD include brain surgery, electroconvulsive therapy, ECT, or a type of shock therapy that provides an electrical stimulation to the brain, or deep brain stimulation. This is a type of therapy that was first used in Parkinson's disease, and it places electrodes in the brain controlled by a generator in the chest. Occasionally, a person will require more intensive outpatient or inpatient treatment due to the severity of their condition. Can OCD be cured? While OCD is most likely genetic in origin, we're currently not able to treat OCD at the genetic level to cure it completely. The best option is therapy and/or medication to effectively manage the symptoms and achieve recovery and symptom management. OCD is a chronic condition, which most likely will not go away on its own. Final thoughts on treatments for obsessive-compulsive disorder. While OCD is a chronic disorder, there are many effective treatments available. If you or someone you love is dealing with OCD, talk to a therapist who specializes in the treatment of OCD or anxiety disorders. Therapists are trained to utilize CBT and make referrals as needed. Remember, you're not alone, and there are resources available to help you and your family. Consider using an online therapist directory to find the right therapist for you.